In addition to the normal catheter setup, you need a Terumo straight guide wire, a 14 or 16 gauge cannula, an additional 10 ml of lignocaine gel, 10 ml of water, and 10 ml syringe. Using 10 ml of water in a 10 ml syringe, attach the syringe to the port on the guide wire and inject the water until the entire guide wire is wet. We now need to modify our catheter using the lignocaine gel and a 14 gauge cannula. Attach the lignocaine gel to the main port of the catheter and inject the lignocaine gel until it travels the entire length of the catheter. Using a 14 or 16 gauge cannula, pass it through the side port of the cannula and puncture the tip of the catheter as close to the apex as possible. Once this is in, remove the needle and place it to the side in case it is needed again later. Insert the guide wire down the penis like you would normally a catheter. When you meet resistance at the prostate, bring the penis down towards the feet parallel to the body. This straightens out the urethra and allows easier access into the prostatic urethra. You may need to bring the guide wire back and forth several times until the guide wire enters the prostatic urethra. Continue advancing the guide wire until 30 to 50% of the guide wire has been placed. The guide wire is quite slippery, so occasionally you may require gauze in order to get a firm grip on it. The tip of the guide wire is quite soft, so once 30 to 50% of the guide wire has been inserted, the guide wire is either in the bladder or it has turned and coiled and come back out the penile urethra, as shown. Once the guide wire is in the bladder, backfeed the guide wire through the cannula, remove the cannula, withdraw the guide wire slightly, and then push the guide wire up the main port of the catheter. Continue until you can grab the guide wire from the proximal end of the catheter. Your assistant holds the wire steady without pulling back while you push the catheter towards the penis. Apply any remaining lubricant to the tip of the catheter and then push the catheter along the guide wire into the bladder. As there is lubricant gel down the catheter, generally urine does not flow. At this point, remove the guide wire and use the lignocaine gel syringe to aspirate from the main port until urine flows. This confirms positioning within the bladder. Remember to inflate the balloon with 10 ml of water before attaching the catheter to the catheter bag.